Hi, my name is Sam. Welcome to this presentation. Today I will be talking to you about Parkinson's disease. There are a lot of people who don't understand Parkinson's disease, and there are also nurses who really don't know how to take care of these patients. So we're just going to go through pathophysiology today and nursing management and how Parkinson is assessed and diagnosed. So we're going to talk about basic pathophysiology, assessment and diagnosis, some of the things nurses can do while caring for patients with Parkinson's, and what we can educate family on. So let's start with what Parkinson is. It's a progressive neurodegenerative disease. It affects the nervous system. It's also associated with gradual loss of cell in a part of the brain called substantia nigra. This part is responsible for dopamine production, and with Parkinson's, it affects that part, and you get decreased dopamine production. So the deficiency in dopamine can cause nerve cells in the substantia nigra to lose control. It makes individual unable to coordinate their movements um, because those cells can die. Um, like I said before, it's a degenerative progressive disease, so it gets worse as you age. Let's look at some of the symptoms and causes. There's actually no known cause of Parkinson's, but there has been some genetic links and environmental links associated with the disease. Genetically, I think it's about 60 or 50% if you have like immediate parents who had Parkinson's disease, or if you have both parents who had Parkinson's at the same time. So symptoms of Parkinson's: shuffling, stiffness, tremors in the hands, impaired coordination and balance, slow movements, difficulty chewing, swallowing, and speaking. Usually these patients are recognizable from the tremors in their hands, um, their movements. They have that shuffling pattern of moving. They move very slow, and sometimes they have stroke-like symptoms. They have droolings in their faces, and they have trouble swallowing and chewing also. Treatment: well, there's no cure for the disease. They don't know what caused it, and they don't have any cure for it. But there are treatments that are manageable. They call them manageable treatment options because they only treat the symptoms of the disease. And one of the main symptoms that are treated is the tremors and the muscle stiffness, all caused by that decreased dopamine production. So treatment is merely like treating the symptoms, but it doesn't cure the disease. Medications: one of the main medications I've given a lot to patients with Parkinson's is the carbidopa-levodopa medication. Um, it's time sensitive. Usually when I have patients who have to take these medications, it's pharmacy will time them, like do not give it 30 minutes after it's due or 30 minutes before it's due. So I usually um, try to give patients the carbidopa like right on time. Another medication is also Mirapex. I've given that to it's and pharma, pharmacogenetics or pharmacokinetics of these medications is just to increase or make your brain more sensitive to dopamine production. There are also surgical treatment, and this is more geared towards people in the late stages of Parkinson's. So surgical treatments include deep brain stimulations. I think they actually put an electrode in some part of the brain, and then there is a battery that goes in the chest that stimulates the part of the brain responsible for movements and coordination. That treatment option is, like I said, it's mostly for people who are in the late stages of Parkinson's. Um, there are also exercise regimen to help with all the muscle stiffness and muscle issues. Assessment and diagnosis. Usually with assessment, it's neurological. It's neurologists that usually do the assessment. They will review the patient's medical record, history, family history, and then they will review the symptoms and do a physical exam. That typically does not, I would say, confirm diagnosis, but it helps to root out some other conditions also. Um, Another diagnosis test they do is the dopamine transporter scan. So the DHE is mostly just to know how much dopamine your brain is producing. They also do brain MRI, ultrasounds, PET scans. Those are mostly to root out all the other conditions. Sometimes the doctors will give the patients, if they're trying to diagnose the patient, they will give them carbidopa and levodopa, and they wait and see if the patient's symptoms improve, because it's one of the effective medications that help with Parkinson's, the symptoms of Parkinson's. So if the patient starts taking this medication and suddenly the symptoms improve, it confirms the diagnosis of Parkinson's. All right, what can we do as nurses? Caring for these patients can be a little challenging because they need a whole lot of care. They, the one thing is they are really high risk for falls. Um, so if you have Parkinson's patients, you have to make sure you have your bed alarm on, their walkers are within reach, call lights are within reach. You don't have cords all over the floor. Um, just a safe environment that they will be able to move freely without falling. So forest is high, really high in its priority when we're caring for these patients in the hospital. They also need assistance with showering, ADLs like eating and grooming. Some patients in the early stages might not need help with like eating, but they might need help with grooming and showering, using the bathroom, and most of the ADLs, they're like 24-hour one-on-one care patients. So when they come into the hospital and As nurses, you're having like 5 or 6 patients to care for. It becomes a little difficult to balance the level of care they need with your other patients that you have. Another thing we can do is encourage exercises, encourage independence, um, allow them to do things on their own, encourage walking, even though it's slow and difficult. We have to encourage that. Work with your social worker to find support groups, take them to social gathering. If you're working in long-term care, sometimes they have activities for these patients. Make sure they attend these activities, meet with people with similar conditions. It helps relieve the stress and the depression that comes with low levels of dopamine production in the brain. If you're taking care of um, your Parkinson's patients at home, for family, I will tell them it's the same thing in the hospital. It's like there are really high fall risks. Um, we do our best in the hospitals to prevent falls for these patients. It can be just as challenging when they go home. So family need to be on alert that patient is at really high fall risk. They also need a one-on-one care. They cannot be home by themselves. So they need to have someone with them all the time. Make sure beds and chairs have alarm. So if you're not paying attention or you're in another room, you can hear the bell alarm goes off when they try to move on their own. Also be around to assist with ambulation and just help your family member or your patient. So you have to help them to move around because they cannot do it by themselves. Help promote independence. It can get really frustrating for these patients because they have trouble moving. They feel like they've lost their independence. It can lead to frustration and feelings of anger over not being able to do things that they used to do before. So you just have to be there to help them, allow them do the best they can do. You have to also stick with medication regimen. You have to remind the patients constantly take their medication, or you have to remember to give them their medications. Provide a clutter-free home. Don't leave stuff laying around. Rocks on the floor, TV cords all over the place. It's a tripping hazard and it can cause really bad falls. They might fall and break something, break a hip, break an arm, which can actually make the situation worse. And like before, it's a degenerative disease, so symptoms get worse as you age. And we also try to prevent infection to minimize hospitalizations. Some of the things family can do at home to help the loved one and the patient. So I decided to present on this topic because my maternal grandfather had Parkinson's. He wasn't diagnosed until his late 70s. That's when he started showing progressive symptoms of Parkinson's. I spent most of my childhood years with him. And until the time he stopped moving. He used to move well. He started having the tremors in his hands. And then he started shuffling. and then words became difficult. Um, and then it just got worse and worse, and he was in the wheelchair, and then he couldn't move his legs anymore. Uh, So it's something that I know about, I've experienced. There have been a lot of famous people with the condition. Muhammad Ali had the condition. George W. Bush also had it. Um, Meaning for these patients, they need 24-hour care. Um, if they're at home or they're in the hospital, they need 24-hour care because um, they are high for risk. And for nurses, it can be a little difficult when caring for them because they need a lot more care than other inpatients, patients that are in the hospital. We should make it our duty to, you know, make sure these patients just the quality of life is increased, and because we cannot cure whatever they have, we cannot cure the genetic condition. All we can do is support them and give them a better life. Thank you for listening. Um, that's all I had to talk to you about today. So if you know a family or if you know people who have Parkinson's, you can tell them, teach them about what Parkinson's is and how we can take care of those patients. Thank you.